Now, one study that we have just recently presented in ESMO Asia, and hopefully come to publication in the near future, is a CheckMate 722. Why is this study important, even though it's negative? Well, we actually had applied immunotherapy in combination of the chemotherapy for patients with EGFR mutation after the failure of TKI. A lot of people use that is based on the concept of the IMPACT 150. But then sometimes they just go on with chemo and IO, and then applying the KEYNOTE-189 into this population. So that's why we do this study on CheckMate 722, which is randomization of the patient who failed the TKI to either chemo plus Nivolumab versus chemotherapy alone. Now, it turned out that it was negative, that was statistically insignificant. There's just a slight difference in the progression-free survival for the patient who received the TKI as a first line. But overall, we don't have a signal. And this is actually compound and supported by the upcoming data, which is the KEYNOTE-789, going to be presented in ASCO. So there will be 2 randomized studies showing the fact that the additional immunotherapy to chemotherapy is actually not going to be that useful. The one next study that's going to help us is going to be the KEYNOTE-151, which will be done in will be completed in China. That is randomization of patient to chemotherapy of unlimited carbo together with Bevacizumab and Atezolizumab versus with Bevacizumab alone. So that data is going to tell us whether we should apply the concept of the IMPACT 150 or 151 to our population.